We're gonna gracefully fade out Shaka. All right, everybody, so it is 6 o'clock and hopefully we have everyone here with us. We want to welcome you to our Real Talk series. First off, if you're comfortable with being called on, please let us know. We are going to have some polls and some questions that we will be asking toward the group to get some engagement. So again, if you're comfortable in participating, please let the hosts know now, send us a message. So welcome everyone to our Real Talk with Creating Healthy Conversations with Young People. Tonight we will be talking about sexually transmitted infections. My name is Maya Glover. I'm an HIV/STI specialist with Planned Parenthood. My pronouns are she, her, and hers. And I've been doing education work just like this for over 1.5 years now.
And my name is Devin Legassi. I am also an HIV/STI specialist and use she, her pronouns. I've been working at various Planned Parenthood affiliates going on 5 years now, but I have been teaching and talking about sexuality-related topics for the past 10 years. So while we're all here together on this Zoom call, we are going to keep everyone muted, both your microphone and your video, just to cut down on those background noises and distractions. But please feel free to chat in any questions or comments that you have to us. You can do that in the chat box and it will come directly to Maya or myself. So this topic, or this workshop tonight, is covering STIs, as Maya mentioned. This is the 6th workshop in our parent workshop series. Next week will be the 7th and final workshop covering sexually explicit materials, so things like pornography or sexting. But all of our previous workshops are available on YouTube, so if you are interested or would like to revisit those and learn a little bit about gender and sexuality, consent, birth control, or how to answer tricky topics, we definitely encourage you to go ahead and check those out. So there are a couple of workshop rules for everybody while we're here. Please take care of yourself. We're only together for a short time. We don't have any built-in breaks, so do whatever you need to do to be comfortable. We're also asking that you be open to new ideas, viewpoints, and knowledge while we're all here in this learning space. We really encourage you to ask questions. We want you to come away from this workshop with whatever it was that inspired you to register in the first place. So like I said, feel free to ask questions to us in the chat. We will stop throughout the workshop to address them, and Maya and I will also hang out at the end of the workshop in case anybody has any additional questions or comments that they want to voice. This is also a no judgment zone, so we acknowledge that everybody is coming into this space with different experiences, values, and knowledge levels, and we just want to make this a safe place for all of us to explore this topic. So just assume good intentions and be here to learn. We also encourage you to take notes. So we're going to be giving you lots of information. Some of that may be helpful to write down, but more importantly, it's a good idea always to take note of any feelings of comfort or discomfort. So if we bring up something for you that makes you uncomfortable, definitely jot that down so you can come back and think about and process through that feeling later.
To go along with the workshop rules that we just established, we do have some workshop goals. First, I want to point out that throughout this session, we'll be saying sexually transmitted infection or STI instead of using sexually transmitted disease or STD, although both refer to the same group of infections. Using STD is still very common, so don't worry if that's what you're still used to. Even Planned Parenthood still uses STD on their website just because that's the more commonly searched term. But we're using STI because it's less stigmatizing and more medically accurate, that these are just infections that are passed from person to person. So during this workshop, we will go over key information about STI transmission, explore ways to discuss supporting a young person when accessing treatment, and discussing how to help a young person develop confidence when talking to a partner about prevention, testing, and STI status. Well, I want to kick off this lesson with a poll. Again, remember, this is a no judgment zone that includes even on yourself. This poll is just to get an idea of where everyone is starting coming into this lesson. So the poll will appear on your screen. You'll have 30 seconds to answer, and it is multiple choice, so choose all that apply to you. So the question of our poll is, what comes to mind when you hear the term sexually transmitted infections? And some of the answers we have available are testing, burning, itching, smelly fluid, dirty, gross, condoms, unprotected sex, treatment, tough conversations with the partner, and scary. So again, take a moment to just look them over, answer what seems appropriate for you, and then we'll go over them once everyone has answered. Okay, we'll give people a few more seconds to get some answers in. All right, awesome. So let's see go over what some answers people have shared. So we have, everyone has chosen something that is all the answers that we have, which is great because that shows just how widespread kind of people's assumptions about STIs can be. It seems the most positive answer or the most popular answer that we have is burning, itching, smelly fluid, and unprotected sex. And that is perfectly mimicking kind of what the general population associates with STIs, mostly because most of the messaging that a lot of us receive about STIs is stigmatizing and shame-based. And that makes it difficult for people to talk about STIs, but also just to get the necessary steps to prevent STIs, get tested, and get the treatment if they need it. So it's awesome to see that we have some really great healthcare-based centered answers around treatment and condoms and testing. But again, these results kind of mimic what the general population would also assume.
All right, so for a lot of young people, their attitude about sexually transmitted infections is, it's not going to happen to me. A lot of adults share this attitude. And while we want to really emphasize and let our young people know that sex is a normal, natural part of most people's lives, we also want them to know that it does come with additional responsibilities like prevention, getting tested, using treatment in the event there is a positive STI test, and also talking to a partner about all of those things. So it's really important for our young people to come away from these conversations understanding that STIs are common and they can happen to anyone. So how can we prepare our young people to go out and make the best, most responsible, healthy choices for their bodies and their lives? First and foremost, we can provide them with accurate information. And this may mean that we have to have some conversations where we address or break down some of the misinformation they've already received. So even if you haven't had conversations with your young people about STIs, in all likelihood, they have heard something about it from somebody, whether that was a friend, a peer, something they saw on TV, maybe a teacher. And as Maya mentioned, they may have received some of that shame-based or stigmatizing information. So when you're providing accurate information, you might have to first address some of those myths that they have already absorbed. And finally, you can also help your young people by discussing and really encouraging prevention. So starting those conversations there. So we acknowledge that having those conversations with your young people can be very difficult. And so we want to go ahead and give you a couple of pointers and tips to make those conversations a little bit easier. So when you're discussing STIs with a young person, the most important thing is to start with making sure you're eliminating that stigmatizing language from the words that you're choosing. So that means avoiding words like clean or dirty or diseased or gross, and really just talking about it from that neutral, educational, accurate perspective. So when we're talking about accuracy, what we're really talking about is using the accurate terms for body parts and for these infections. So calling a penis or a vulva, calling things like gonorrhea, gonorrhea instead of the clap. So using those really correct terminology. Be honest with your young people that STIs are common. For example, we know that over half of all new chlamydia infections occur within young people between the ages of 15 and 25. And so sharing that information is not meant to scare your young people, but to really drive home for them that they are common, they happen, and they can happen to anybody. Focus those conversations on prevention and testing and treatment, normalize those behaviors, and really stress for your young people that it's important not to wait until symptoms appear. And we'll talk more about why that's so important later. And then also don't wait until your young person says they're having sex to have these conversations. So if you think about everything else in our education system, whether that's English or math or science, we give our young people the information we think they'll need later on in life before they need it. It should be the same kind of thing for information about sexual health. You want to make sure they have that information going into those situations, not after the fact. So we really want to prepare our young people with building certain skills. And we can do this by encouraging and supporting access to testing, encouraging and supporting access to treatment, and really building their confidence around communicating about all of these things with a partner. And so these are the skills that we are primarily going to focus on throughout this workshop.
It can be overwhelming trying to get all the information that a young person can be prepared with. We surely don't want to give you any flashbacks to your 6th grade sex ed class. We want to make this as less stressful as possible. But as we mentioned, we do need to set some ground rules, some ground foundation about STIs, just so that we all have a starting place when we're having these conversations. You do not need to be an expert on STIs to support your young person, but we're going to give you some tools and tips that you can use to kind of help this along. So what causes STIs? It's important to be able to explain what causes them, because even though a lot of youth are aware of their existence, they have absolutely no clue how STIs happen, and they don't have the correct context in which to talk about these STIs. So STIs are caused by 3 things. There's bacterium, like with chlamydia, viruses, like with herpes, and parasites, like with pubic lice, which are also known as crabs. Bacterial and parasitic infections can be gotten rid of with treatment, but reinfection is possible after the treatment. Viral infections are treatable, meaning managing the symptoms, because just like with any virus, they do stay in the body, but how they can progress in the body varies. An example is someone with HPV or human papillomavirus may never show symptoms or cause damage inside their body, but for some people, it can lead to cancer. Another example are some individuals that are living with herpes never know because they don't have any flare-ups, while some people do. So they are aware of their symptoms. It's important to note that many people with STIs never show any symptoms. A lot of youth believe that they would know if they or their partner had an STI because they would see or experience the itching, burning, smelling that's commonly associated with STIs. So it's important to remind them that that is not always the case. So STIs are spread through anal, oral, vaginal sex, as well as skin-to-skin contact of exposed genital area. So again, that's not, say, if they're touching with any type of clothes on or any barrier exposed skin. A reminder that anyone who has anal, oral, or vaginal sex or skin-to-skin contact can contract an STI. It does not matter the gender or the sexual orientation. Although not all STIs are transferred through the same type of sexual activity. Chlamydia, for instance, is spread through genital fluid transfer, while herpes is spread through skin-to-skin contact of the genitals or the mouth, and pubic lice are spread through the close genital contact of pubic hairs, hence the name, because they like to live on the pubic hairs. Activities such as needle sharing can also spread STIs. With tattooing become way more mainstream, it's important to let young people know that should they want to get a tattoo, it's important they go to a licensed and reputable artist and shop to keep themselves as safe as possible. But today we're going to focus on STI spread through sexual activity. Even with this basic knowledge, there are still tons of myths and misinformation that people can believe. As Devin mentioned, kids can learn all sorts of incorrect information about STIs from the playground to social media, and that can stick with them well into adolescence, and that affects the healthcare choices that a young person makes. And this is why it's important that they receive the correct information as well as that support. So let's break down some of these common myths. Number one, myths about what fluids STIs are spread through clouds correct information, and it stigmatizes people living with STIs since they are seen as more infectious than they actually are. An example of that is the myth that people with HIV can spread it via sweat leads to discrimination from them accessing swimming pools, sports leagues, gyms, and other public group spaces. And number two, that STI is a result of having too much sex or multiple partners. This myth feeds into that stigma that contracting an STI is a form of punishment, and that if someone has a lot of sex or has multiple partners, that they deserve to get an STI if they end up contracting one. Many young people think that just having sex sometimes or just with one person means they can't get an STI, and even that means that they don't need to get tested or they don't need to use protection. It's important to reinforce that there is still a risk with one partner as there are with multiple partners, as is having sex one time with multiple times. Number three, that STIs can only occur at one time. Just like it's possible to have a cold and an ear infection at the same time, it is possible to have more than one STI at the same time since they are different. Number four, STIs spread because of bad hygiene. We're told that washing our hands protects us from getting sick from viruses and bacteria, so many people assume that same logic applies to STIs. So STIs are often associated with the lack of showering or the lack of genital care. In truth, that's just not how STIs work. It would be great if we could just keep up with our hygiene and use that as a prevention method, but unfortunately, we have to remind our young people that, again, that's just not how STI prevention works. And lastly, STIs only spread when a person has symptoms. This one is a big one because, as I mentioned before, young people tend to believe, oh, I'll see it, I'll know it, and that's a clear sign that there is an STI. And again, many people do not show any symptoms at all, and sometimes don't even know how long they've had it because of that. So this is why prevention is key. So if you've attended our birth control session, then you've seen us mention these items before, but if you haven't, I would highly recommend checking it out. Our facilitators are great, and also you'll get familiar again with these items. But not only are they awesome for types of birth control, but these are also great at preventing STIs. So barrier methods like condoms and dental dams. And side note, for a dental dam, for those who may not be familiar with, it's basically just like a flat condom that can be used over the vulva or the anus during oral sex. And also, fun fact, if you're in a pinch and you're looking for a dental dam, you can just take a condom and cut it lengthwise, the more you know. But barrier methods like these are great because they are preventing that skin-to-skin contact and also the fluid transfer that these STIs can be carried through. Note that condoms don't cover all exposed areas of the genitals that can be infected, like the scrotum or the labia. So especially with items like dental dams, that comes into a later conversation of how to use these barrier methods effectively. And lastly, there is PrEP, which is pre-exposure prophylaxis, and that is a once daily pill that can be taken to greatly reduce your risk of contracting HIV. Just like birth control, PrEP must be taken daily for it to be effective.
So just like there are a lot of myths about how you can get an STI, there are also lots of myths about how you can prevent STIs. So probably the most common one, the one we hear most frequently when we're working with young people, is that pulling out prevents STIs from spreading. So pulling out, just removing a penis before it ejaculates, that's all that means, is not effective as an STI prevention method because a erect penis, as soon as it becomes erect, starts to create something called pre-ejaculate, And that pre-ejaculate can not only have sperm, it can also have the bacteria or viruses capable of spreading an STI. So oftentimes when we're working with youth, I will let them know that everybody's pullout game is weak because of that pre-ejaculate. Very similarly, our young people often believe that just inserting the tip will prevent STIs from spreading, or that no penetration at all will prevent STIs from spreading. So again, there's that pre-ejaculate there when there's just the tip. And as Maya was just talking about, there are some STIs that can spread through skin-to-skin contact. So even if there's no penetration, if genitals are coming into contact with each other, it's still possible to spread things like herpes or HPV. Another myth that we hear often is that having sex with someone of the same gender means it's impossible to get an STI. And this is really important to note because for a lot of our LGBTQ youth, when conversations around STIs and prevention come up, they will check out of those conversations because they think, this doesn't apply to me. I'm only having sex with people that have the same genitals as me. So it's really important to address that myth with our LGBTQ youth in particular so that they know that all of this information applies to them as well. And it's also important to note that certain positions do not prevent the spread of STIs. So this is another myth we hear occasionally, but there is no position in Cosmo or the Karma Sutra that's going to stop you from getting chlamydia. That's just not how it works. And what's really important to understand about debunking these myths is that they can have an effect on young people's behavior and the choices they make around their sexual health. So someone who believes that pulling out prevents sexually transmitted infections may never bother to use a condom. Someone who believes that having sex with someone of the same gender means no STIs may not consider testing or having those conversations with their partners, or if there's someone who identifies as straight and is engaging with sexual activities of someone of the same gender, they may not really consider that sex or really know how these things are transferred, and so also may not bother with getting tested or having these conversations with that partner. So we want to give you all an opportunity to practice and think about how you might have these conversations around STI transmission and prevention with the young people in your life. So we have a couple of examples here, and I'm going to go ahead and call on one of our fabulous volunteers. Joe, are you willing to take on this example? I think I have to ask to unmute you. Oh, maybe she can. I don't know if you're talking, Joe, but you're on mute. All right, we'll come back to Joe later, hopefully. Let's see, who else do we have on the call today? All right, Dion, would you be willing to answer this question for us? Where are you?
Yeah, sure.
Awesome. So for this first example, your 12-year-old asks you, why do people have sex if they can get an STI? So how might you respond and think about talking about transmission and prevention?
Well, I would try to say something that is like sex positive, like, you know, sex can be very healthy and very positive, but there's risk involved, just like there's risk involved with a lot of things that can be healthy and positive. So it's just important to take steps to try to prevent those things like STIs, like talking to your partner, using condoms, and getting tested.
Yeah, great. I think that's a great answer. I think making sure that you're still talking about sex in that positive, normalizing way, you did that while also emphasizing that, just like Maya was talking about, there is a lot of responsibility that comes along with the decision to have sex. So really emphasizing that with this young person. And that might also be an opportunity to talk to them about people have sex for lots of different reasons. And that's fine, that's okay. But regardless of their reasons, like, you do want to be responsible and take care of your body. So that was great. Thank you. Would you be willing to do our second example here as well?
Yeah.
Awesome. So in this example, your 15-year-old says that they wouldn't have sex with a quote unquote gross person, so they don't think they need to use protection during sex. So how might you respond to that person, that young person?
First, I would wonder what kind of sex ed they were getting if they were calling someone gross like that. So I think we would have a conversation about that word because it sounds really mean, and for me, it doesn't even really make sense. Like medically, that doesn't make sense. We're talking about just like sex and STIs, and I also get the impression that my 15-year-old thinks that they would just know if someone had an STI. So I think I would just, one, tell them not to be mean, and two, just really talking about that it's important to use protection because you can't see an STI. You don't just know if someone has it.
Great. That is an excellent answer. And I think you hit the two big points in this example. So the first point being really addressing and pushing back on that word gross and that kind of stigmatizing mindset around maybe the type of person who gets an STI. So really pushing them to examine that and emphasizing that the type of person someone is does not affect whether or not it's possible for them to have an STI. And then the second part, that second major point of making sure they know that it's impossible to just know if someone has an STI. And so that prevention piece of making sure you're talking and getting tested and really normalizing that is important when you're having those conversations. So excellent job. Thank you so much.
Thank you.
So we are going to pause for a minute and just address any questions or comments that have come into the chat box while we've been moving through all of this. Let me see here. All right, so we do have a question. Somebody asked, I have heard different information about the HPV vaccine. Who should get it? So the HPV vaccine, some of you might have heard referenced as Gardasil, is a series of 3 shots that people can get to help reduce or eliminate their chances of getting certain strains of HPV or human papillomavirus. And the answer of who should get it is everybody. So we know that certain types of HPV can lead to different types of cancers, so cancers that affect the penis, the throat, the vagina, as well as the cervix, which some of you may have heard of. And so it's important for everybody to get the vaccine like the Gardasil or HPV vaccine so that we can prevent the transmission, because as Maya said earlier, a lot of people don't even know that they have HPV, or they may not show symptoms, or it may not affect them personally, but they can still be a carrier and pass it on to others. All right, so, we also have another question pop in here. So somebody asked, this is a good question too. So somebody asked, wouldn't you want to address the decision to have sex as a 12-year-old? So this is referring back to the previous slide where the 12-year-old is asking why somebody would have sex if there's a risk of STI. So I do want to clarify, in this scenario, the 12-year-old's not necessarily asking, should I have sex, or I want to have sex. They're asking, like, why would someone even risk it if you could get an STI, which I think is probably where most 12-year-olds are at, right? They're still trying to figure out, like, why does the risk, like, outweigh the reward here? And so that's maybe where their curiosity is coming from. But a lot of adults may have some very strong feelings when young people are asking them about sex, especially when they're as young as 12 or 13, and it can cause a lot of feelings. And we do really want to emphasize that you can be sex positive and talk about it as though it is a normal, natural part of people's life, without necessarily saying to a 12-year-old, it's okay for you to go have sex. So that's what we're trying to get at with this conversation and this presentation, is really making sure the young people in your life know that sex is normal, but it also carries a lot of responsibility. And they need to be ready to take on those responsibilities And for example, I will often tell the young people that I'm working with, if you're not comfortable talking to your partner about whatever it is, whatever sexual activity it is, or about testing, you're probably not really ready to be engaging in those activities because you have to be able to talk about it. So it's definitely possible to balance those two things in these conversations of normalizing sex and making sure you're talking about it in a positive way, while also making sure the young people around you know that it's not a decision to be made lightly and there are additional things they need to be thinking about and considering before they are ready. Maya, do you have anything to add to that?
No, I think, yeah, that's perfect. A lot of us can feel very conflicting ways when young people come to ask us these questions, especially when we feel like, oh my God, you're too young for this right now. But like we said, we can still give them answers that are age appropriate and still prepare them with information without kind of like sending them off to the wolves.
Yeah, great, thank you.
All right, if there's any other questions, we will definitely make time at the end to answer those further as well. So with great power comes great responsibility, like we just talked about. And just like Uncle Ben told Peter Parker when he accepted his role as Spider-Man, there are some changes that need to be made to keep the youth safe. Sexual activity is a positive element of many people's lives, and when someone starts to have sex, and that can spread STIs, they need to add new elements to their healthcare. That responsibility includes testing, possible treatment, and conversations with their partners about STIs. Young people may be used to an adult who guides their healthcare and not sure how to access it on their own. So let's talk about some ways adults can support young person as they access testing and treatment. All sexually active people should be tested regularly for STIs, but it can be difficult to access testing for as a young person because just telling them to do it is not enough. I'm sure as many of us know, telling a young person to do anything needs to be followed up with, right? So again, we want to support our young people by help guiding them through these steps as well. Young people often hear of the negative consequences of why they should make certain healthcare choices, but explaining the benefits of making these healthcare choices can overcome the stigma or fear they may have about them. So an example is saying, knowing your status can make sex less stressful, and it can show respect that you have for your partner as well as yourself about not only your health, but their health as well, as opposed to you may catch something that can make you really sick. There is no one size fits all when it comes to the frequency of testing. So here are some things to consider when thinking about appropriate timing. If anytime anyone has a new partner, that's a good point to consider getting tested. If the more frequent they have a new partner, the more often that testing should occur. So an example could be every 1 to 2 months. Every time someone has multiple partners in the same time period. If there are any symptoms, is a huge reason to go get tested. Even if someone has a single partner, they should be getting tested at least annually. And that's because really building up that habit makes it less likely for someone to forget to check in on themselves, right? Even when we go to the dentist and we go to the doctors, we make a note every time to come back every 6 months or so. A lot of young people think that if their partners are tested, then they don't need to be tested. But we want each young person to be responsible for their own healthcare. So in this instance, if their friends are doing it, it's okay for them to do it too. Now that we've had a conversation about a young person's new responsibility, we can further support a young person on this new journey by helping them get comfortable with getting tested. So walking them through what testing is like helps a young person feel more prepared and more comfortable when they make those steps. So first, making an appointment for testing. Helping a young person schedule an appointment, especially if they're not used to scheduling their own doctor visits, is a great first step. My dad started me off with making the pizza calls for dinner, and woo, that was nerve-wracking, but I made it. So just like with our young people, they're can be shaky about that. And even nowadays, they'll probably be more comfortable with making an appointment online. You can still help them walk through that process and get their information that they need to make that appointment. Number two, the patient will talk to the provider and decide the necessary test. During that appointment, the screening, the provider will do a screening, which is just a series of questions that the patient will be asked to make sure that they're getting the most appropriate care. Because this is private between the patient and the provider, this is a time in which an adult can be asked to step out the room if they did decide to accompany that young person to the appointment. But it's also totally okay if a young person decides to go get tested on their own. In the state of Illinois, a young person can start getting tested or start getting access to testing on their own at the age of 12. So some questions that a patient can anticipate being asked are the number of sexual partners they've had, how often they use protection like condoms or dental dams, and if they or their partner has ever had an STI before. So once they've finished that screening and move into actually administering the testing, you can prepare your young person to anticipate what that might look like. So there are not one test for all STIs, and that testing process can look different depending on the STI test that that patient is getting at the time. So that test could be an oral swab, it could be a urine sample, a blood droplet or a blood draw, or just as simple as a physical exam. And some test results come in under 20 minutes, while some need to be sent to a lab for it to be tested. So once all of that has happened, and the patient will receive their results, and that can also look different. So some offices will call the patient if the results are negative and if the results are positive, while some offices will only call if the results are positive, and they will not contact the patient any further if there are a negative result. But patients can also just call into the office that they received their testing with and see if they can get their results, as long as they wait that 2-week period for the results to come in. If there is a positive test result, the patient will be given the appropriate treatment. And it's important to remember that all STIs are treatable and most are curable, though reinfection is possible with some STIs. So getting that treatment is key. All right, so we've covered a good chunk of information so far. So we just want to give you all a moment to kind of take that in. If you do have any other questions that have come up, please put them in the chat so we can address them later. But now we're going to get into what seems to be the most daunting part of this whole process for young people, and that's talking to a partner about testing. Since so much stigma and shame are associated with STIs, young people may not know how to start the conversation, and honestly, they would rather do math than talk to their partners about STIs. But here's how an adult can support that conversation. Giving a young person an excuse to bring up the conversation can make it so much less awkward. We often tell young people when we're encouraging talking to their partners, just let them know that some random person came to your class and started talking about STIs. And since I mentioned it, do you know your STI status? It can make it a lot more smooth to try and incorporate that conversation. Being honest with this conversation may be very hard. And so validate their feelings, whether they're confident, which is amazing, or even if they're nervous, which is completely natural. Reinforce that just because it's difficult doesn't mean that it should be avoided. Again, sexual activity comes with responsibility, and one of them is communicating with their partners about STIs. And let them know that their partner may not be receptive to talking about STIs. As we discussed earlier, there's a lot of shame and stigma that go along with this conversation that many people have. So prepare that young person that even though we're having this conversation today, not everyone gets this type of preparedness, right? So let them know that that is a possibility. And they can hear responses like you see on the screen. So you don't love me, you don't trust me, you think I'm dirty, are you cheating on me? Those kinds of things. And lastly, have that young person practice what they want to say to their partner and how they'll respond to potential negative responses, right? So if their partner does say, you think I'm dirty, role play with that young person on what are some responses they can come up with so there's not a chance of like deer in the headlight situation, right?
All right, so thank you, Maya. So now that we've talked about how to have conversations around testing, we're going to do another example, and I'm going to call on somebody else for this one. So let's see here. Paula, are you willing to step in and handle this example?
Hi, yes.
Awesome. So in the first example, your 14-year-old says their girlfriend tested positive for chlamydia, but they don't feel sick, so they probably don't have it. So how might you respond and use this as an opportunity to talk about testing?
Well, what if I said to them that, look, they probably do, because what I'm hearing from your friends and from other parents on our Facebook, community group is that this person likely does. So you better go get tested or you're not going out the house again.
Okay. All right. It's like a very firm stance. So, I mean, I think it's absolutely making sure that they are encouraged to go and supported and going and getting tested is absolutely something you want to emphasize in this conversation. And you want to make sure that when you're having this conversation with them, you're not reinforcing any of those maybe negative stigmas or tendencies that we have to associate certain types of people with STIs. So maybe leave the gossip on Facebook out of it for now. But I think it is really important to talk about, like, you are having sex and your partner has tested positive for chlamydia, and it is very likely that you have it because a lot of times these STIs don't have any symptoms. And so it's really important for you to go and get tested, and maybe in order to help them so that they can someday leave the house again, you offer to drive them to the clinic, right? So we really want to make sure that in addition to talking about testing with our young people, we're also supporting them in making that choice. But thank you, that was great. Do you feel comfortable doing the second example here?
Oh, sure.
Awesome. So in this example, your 17-year-old says that they don't get tested because they use condoms during sex and they know their partner doesn't have anything.
Well, I would sit my 17-year-old down and have a conversation and revisit previous conversations that we've had about birth control, notably that condoms provide an extra layer of protection, particularly when used with another form of birth control. So if you're simply using condoms, just a reminder to also use another method. And I'm glad that you have faith in your partner. That's wonderful. But these things happen and you don't know. And if there's a question, get tested. No shame in the game. Just go get tested and then let's just get it taken care of.
Right. So again, emphasizing the importance of just making testing a regular thing that you do, right? Like, I think it's really great. One, that you sat down with your kid and like made a space and a time to have this conversation. I think it's also really great that you were building on previous information and previous conversations around birth control, around STIs. Reinforcement is always really great to help make sure these lessons that we're trying to impart with our youth stick. And I think that point of kind of pushing them to think about, like, well, how do you know your partner doesn't have anything? Because as we've talked about, you can't know just by looking at somebody. The only way to know is to go and get tested. So I think definitely really you did a great job of emphasizing that to that young person. It's important to just go get tested, get it taken care of, and then you will know, right, that everything is good. So that was great. So thank you very much, Paula. You did a great job.
Thank you.
So we want to really emphasize when we're talking to young people, not only is it important to get tested, it's also important to follow up that testing with treatment in the event that there is a positive STI result. So treatment is important because it reduces the chances that there will be permanent damage, and it also prevents an STI from doing any sort of increased damage. And as Maya mentioned earlier when she talked about the testing process, treatment will look different depending on the STI. The timeline for that treatment will look different depending on the STI. But one of the things we also really want to emphasize with young people is the importance of partner treatment. So we know that it can be really difficult for young people to have these conversations in the first place. We also know it can be really difficult for them to then go ahead and follow through on accessing treatment. And so what happens is one partner will get treated, and then the other one, maybe because they believe some of those myths we talked about earlier, or in that previous example of, well, I don't have any symptoms, so I obviously don't have it. So the partner does not get treated, and the two of them end up just passing the STI back and forth like a football. We want to prevent that from happening by really emphasizing the importance of everybody getting treated in the event that there is a positive STI result. So how can we support a young person who does test positive for a sexually transmitted infection? First and foremost, be conscious of the language that you're using when they come to you. Don't judge or use stigmatizing words. In all likelihood, that young person is already experiencing a lot of negative feelings toward themselves or their partner. They may be really afraid or unsure of what the next step is. And so it's your job to be the rock in that situation. Internally, you may be freaking out. That's normal, but you can freak out externally later. In that moment, it's important for you to be the support that young person needs. And praise the good choices that they've made up until this point. So the fact that they are coming to you and talking to you about this is a good choice. It can be extremely difficult for a teenager to not only let the adult in their life know that they're having sex, but that also they have a positive test result. So the fact that they were brave enough to do that is amazing. The second thing that they've done that's really great is they went and got tested in the first place. They took ownership of their healthcare, and that is absolutely a choice that we want to affirm for that young person, so they feel good about that. Reinforce that correct information we've been talking about throughout this workshop. Reinforce for them that healthcare is a part of being sexually active. STIs are a risk. They happen. They are a part of sexual activity. Treatment is part of that responsibility. And also talking to their partner is a big piece of that responsibility. So again, we really want to make sure that we're also offering support to accessing treatment. So back when schools still happened in a school building, one of the things that we would do is go in and offer free testing for chlamydia and gonorrhea. And because we were going to the same schools every year, we were seeing the same students year after year. And we had multiple cases where we would see a student who had the same case of chlamydia as they'd had the year before because they had never actually completed the process of going to pick up treatment. And even though we had contacted them multiple times, even though the treatment was free for them to access, even on occasion we would provide them with bus passes in case transportation was an issue, they still did not get the treatment that was being offered. And that's because accessing it can sometimes be the hardest part for a young person. So being the supportive adult may mean driving them to the clinic or helping them pay for it, or it might just be like giving them that gentle nudge every single day until they go and get their treatment. So another way to be supportive of that young person who's had a positive STI result is to prep them for having that difficult conversation with their partner or their sexual partners. So just like with talking about testing, acknowledge that it's going to be a hard conversation, but also reinforce that it is a necessary conversation. You might have to prepare them again for those negative reactions. Sometimes we will hear from young people that they're okay with talking about testing, but we'll also hear someone say things like, oh, if I find out my partner gave me an STI, I'm going to like beat them up. Like this is happening. So it might be part of that support might be strategizing with them to make sure that that conversation happens safely. So maybe that's ensuring that it happens at home while you're nearby, or making sure that it happens over the phone so that there's no threat to their physical safety during this conversation. And just like with communicating about testing, again, practice with that young person what they want to say. Let them think through and process out the bullet points and the language that they're going to use when they tell their partner that they've had this STI result and they need to go get partner treatment. So we are going to do another quick poll here. In this instance, We are going to give you an example, and you will be able to select as many responses as are true for you. Just like in that first poll, it's multiple choice. Let me pull it up here. So in this scenario, your 18-year-old tested positive for an STI that they think they got from cheating on their partner. They don't want to tell their partner they got a positive result and got treatment because it will hurt the relationship. So I'll read through these results, but you can also read through them. This one's a little longer, so I'll give you a little longer to reply. But again, you can select multiple responses. So maybe you say, well, that's what you get for cheating. That's karma for you. I understand this is going to be a hard conversation. It's important that you tell all of your sexual partners so that they know how to take care of their bodies. It's really great that you took control of your health and went and got tested. It's hard to know when you contract an STI, which is why it's so important to get tested regularly. And I can't believe you cheated on your partner. I'm so disappointed in you. We'll give you all a couple more seconds here. All right. I'm going to close it in 5, 4, 3, 2, 1. All right. Let's see what we got. So for most people, their responses to the situation are, I understand this is going to be a hard conversation. It's important that you tell all of your sexual partners so that they know to take care of their bodies. It's really great that you took control of your health and went and got tested. And we also had people respond with, it's hard to know when you contracted an STI, which is why it's so important to get tested regularly. Excellent. So you all have clearly been paying attention. Again, we're just in this situation. It's great to just reinforce all of those steps or points that we've made about how these conversations with a partner can go, right? So acknowledging that it's going to be difficult, but also really reinforcing the necessity of these conversations because everybody has the right to take care of their bodies and be healthy, and really affirming that young person as well for the good choices that they have made. I don't want to say impressed, but you all dodged these a little more judgy or stigmatizing responses. And I think a lot of us might respond with that, like, I can't believe my child has cheated on their partner. And that might be a conversation to have later. But in this instance, it is good to just really focus on the importance of prevention and testing and having those conversations with the partner. Great job. All right. I'm going to stop sharing here.
So as Devin said, congratulations. And we're great to see that you guys are paying attention to all the points that we were giving you. So you are well on your way to supporting young people and navigating STIs and the conversations that come along with them. So here are some key points to wrap up this session. Stigmatizing and fear-based messaging does not work. And it can cause more harm by making a young person afraid to make healthy choices by getting tested and having those conversations. Sex is a normal and positive experience in many people's lives, but it also includes risk and responsibility. And we need to reinforce for young people that that responsibility they are in control of, and it is now something that they have to take on. Support a young person by discussing prevention, testing, and treatment, and ideally before a sexual activity starts so they're prepared beforehand. As we discussed, there's a lot of myths that young people believe, and they're getting bombarded with these myths from social media, from classmates, from wherever else they may receive that messaging from. That prevents them from thinking they need to access those things. So we want to reinforce that everyone should be doing this, and then to keep them prepared before they even start sexual activity. And lastly, talking to a partner about testing and treatment is difficult. So help a young person develop those communication skills so that way they're a lot more comfortable having those conversations with people. So we want to leave everyone with some challenges that they can take with them, not only practicing what we've talked about today, but thinking about in the future, how can we implement these tips? So the first one, the next time you're making a medical appointment for your child, have them be the one to do it while you support them. So it even doesn't have to be an STI test. It can be their next dentist appointment, doctor's appointment, whichever, if it's ordering Chinese for dinner, whichever step you feel might be most appropriate for your young person, and just getting them used to that process. And then next, reflect on the negative messages and values you hold about STIs and write out what you actually want to communicate to your young person. So as we saw in the poll at the top of this session, that there's just a lot of stigma that everyone can hold, and that's just natural. Again, it's the messaging that's most commonly received. So taking a moment to really think about what you're holding on to when it comes to STIs and really focusing on, based on that, what is the true and accurate messaging that you want to send on to your young person?
So thank you all so much for being here. We know that you have busy lives, and we appreciate that you took some time out of them to be here in this space and talk about STIs with us. As always, we welcome any questions or feedback that you have. Maya and I are going to hang around for the next little bit in case anybody does have a question, or if they want to come off mute and ask in case they don't want to type it. Please feel free to do that. We would love your feedback on this presentation, so you can contact us at ppilleducation@ppil.org, or we will also be sending out a survey. There should be a link popping up in the chat, and it's only 5 questions long, so if you have a couple minutes to just fill that out for us, it really helps us improve this for future workshops. But really, thank you all so much, and if you would like to sign up for next week's webinar workshop, you can register either at that link that's now on the screen, or because we live in this newfangled technologically advanced century, you can just take a picture of that QR code and it should pop up with a link on your phone and take you to the web browser where you can register there. So we will hang out in case anybody has questions. Check out the survey in the chat. But really, again, thank you all so much for being here. It was great.
Thanks, everyone. Enjoy your night.
Okay.
Let's see. Devin, can you see the chat questions that we have?
Yeah. Okay, there's the chat. Are there continuing education hours given for this workshop? That is an excellent question. I don't know. My guess is I don't know. Let's see. Maybe, okay, the answer is no. Sorry. But that would be a great thing we can look into for future workshops.
Yeah. I think I saw another question that this one is it true that pretty much everyone who is sexually active will be infected with HPV? That is what I saw on the CDC website. I think actually, Devin, this might be a good question for you since I know you've talked about Gardasil before.
Yeah, so 1 in 2 people are infected with HPV. 1 in 2 sexually active people are infected with HPV. There's over 100 different strains of HPV. So for a lot of people and for most of those strains, they pass through the body within a year or so. But as we talked about when we talked about the vaccine, there are some strains that can lead to genital warts or various types of cancer. So it is extremely common because it's passed through skin-to-skin contact. It is extremely easy to pass to people because, again, most people don't have any symptoms, don't know that they have it. So definitely trust the CDC website. So yes, most people will be infected by 30, which is why it's so important to go and get those regular yearly Pap tests.
Any other questions?
All right, but yeah, so we're here, and if you're hopping up. Have a good rest of your night.
Yeah, looks like those are all the questions. Yeah, have a good night, everyone.